Hey, all. My name is Jack Palo.
Spencer Pike.
And I'm Danny Walther, and this is our pathology synopsis on skull fractures. Okay, so for the kinds of skull fractures, there are six skull fractures in general, but only four that are the most common and have the most research on them. The two that don't are a growing fracture and a compound fracture. And the four that do have a lot of research and are the most common are a linear fracture, a depressed fracture, a diastatic fracture, and a basilar fracture. And the most common causes of these fractures are falling, especially in children, falling, motor vehicle accidents, being hit with an object, physical assault, and sports injuries. And the most common signs and symptoms, obviously, there are a lot of signs and symptoms, and there are ones that are specific to each kind of fracture, but the most common are similar to that of a concussion. So confusion, dizziness, poor memory, headache, nausea, bruising, seizures, swelling or bleeding of the head, and loss of consciousness. For diagnosis, there are many ways to diagnose a skull fracture. I know that we can't do that on our own, so we do have to refer and get some imaging done. The most common and one that comes up with the best results is a CT scan, which is most commonly paired with an MRI. MRIs are mostly used more so for the brain injury aspect of a skull fracture. It doesn't really see the break, it sees more so what's going on in the brain. X-rays aren't very commonly used. It's just kind of on a need basis. If that's all you have, that's what we'll use. And then the last one is a blood test. And again, that one can't really diagnose a fracture, but it can diagnose the brain injuries that occur with.
So, as said before, this is a linear skull fracture. It is the most common. It is essentially just a break in the cranial bone, and it looks like a thin line on the X-ray. And the key thing about a linear skull fracture is that it doesn't move or displace the bone, and there's no splintering or obvious deformity when you look at it. So treatment for this, observation in the hospital for a couple of days. There's usually no interventions that are going to be needed with this, and you can actually return to normal activities within a few days.
And then for the depressed, most of the time you the cause of this is like blunt trauma to the skull. So like a bat or you uh you fall, which that is normally in the younger population, like infants, if they get dropped or something. A lot of times, it is seen with a cut in the scalp, and then going with that, the for surgical intervention, if it's an open fracture. So with this, if the skull cuts the scalp, that would most likely indicate a an open fracture, and then also more surgical interventions would be needed if the dent is greater than 8 millimeters deep, and if the actual fracture causes any damage to the dura mater.
So the third fracture on our list is a diastatic skull fracture. These fractures occur along suture lines in the skull, and most commonly the lambdoidal suture, which is in the back of your skull. What happens is normal suture lines become more wide and they can reveal certain parts of the brain. And so treatment for this is surgery may be needed to prevent brain damage. And so essentially what they do is they lift up the skull and they kind of just put it back into place. And this type of fracture is most common in infants and newborns when they get dropped on their head.
And then for basilar fractures, this is the most serious type of skull fracture. And it happens when there's a break in the spine at the base of the skull. So like right under your occiput, and sometimes I guess, yeah, sometimes to the temporal bone. So sometimes close observation is required, but as you can see with the common signs and symptoms, I wouldn't think there would be close observation required if you have bruising and bleeding at the site. But all uh, other signs and symptoms also include obviously pain, maybe some meningitis, and possible loss of consciousness. Also, with these types of fractures, you can also have cerebral spinal fluid coming out of your nose. Um, Also, this type of fractures primarily caused by direct force. And actually, I'll get into that with the case study I found. So this case study consists of 100 subjects, 89 males and 11 females. And their main focus was determining if there was a correlation with cerebral spinal fluid leakage and meningitis. Turns out there's really not with these kind of fractures. So what they found was that cerebral edema and was correlated with the need for surgery, and that 85 of the deceased patients had died from a motor accident, and from those 85% of the population, 85% of those 85% had um, cerebral spinal fluid injuries or cerebral spinal fluid leakage, I should say.
So this is a special considerations for the pediatric population. So we wanted to dedicate a portion of the presentation to this because the pediatric population is actually more likely to get skull fractures than adults. And this is just due to their skull being thinner and more pliable. Um, Again, just like adults, they're most commonly caused by accidental falls, but other MOIs can include sports, vehicular accidents, direct blows, and anything similar to that type of thing. Um, in the pediatric population, also, depressed skull fractures are more common, then followed by linear fractures. And again, that's just due to their skulls being a little bit more pliable. You get a little bit more of an indent from a direct blow. And skull fractures in the pediatric population as well are also more likely to cause hematoma in the brain. Again, just some more special considerations, things to look out for. This left list of bullet points is stuff that you should work into your history when evaluating a pediatric case of a skull fracture. So if there were any witnesses to the injury, the mechanism of the injury, the condition immediately following the injury, were they crying, were they awake, or did they end up losing consciousness? Previous history, how high they fell, and for if it was a vehicular accident, the type of vehicular accident. So if it was like super serious or just like a small accident, and then the time and presentation of the injury. And then these bullet points on the right are other pathologies that usually occur with skull fractures in the pediatric population. So you want to make sure you rule out different types of hematoma, rule out any seizures, venous sinus thrombosis, intracerebral bleeding, leaking spinal fluid, and meningitis if there was an open skull fracture, and then any kind of neurovascular complications as well. And these are references.
So for things that we learned from this project, the major thing that I took away was I didn't realize how like some skull fractures weren't as severe as you would expect them to be, because when you hear skull fracture, you're like, oh my gosh, the brain is there. There's going to be a lot of damage going on over there. But some of them you can literally just send them back to play, or like not to play, but like back to daily activities, which is crazy. I found that really interesting.
Going off of what Danny said, yeah. So with you do have those, it's interesting that it was interesting to see that, especially with the basilar fractures, even though it's the most severe, the cerebral spinal fluid leakage didn't necessarily mean that it would cause someone to go to the hospital and get surgery. Um, but if they had cerebral edema, they would have to get surgery, which to me, I would think that actual cerebral spinal fluid leakage would be more needed of surgical intervention rather than a brain bruise. But also, I'm not that versed on the brain yet, so I may be wrong on that front.
And I guess for me, just learning more about the different pathologies and things that can also happen when a child suffers from a skull fracture. Like just making sure they don't have seizures, any hematoma, and all that kind of stuff. I just didn't realize that there could be so many different complications, not just the one thing, but like 3 or 4 things that are also happening in children, and just making sure that you're ruling all those things out and being certain that there's nothing else going on, something that's more serious and life threatening. And yeah, just making sure you have a thorough history. I just thought that was crazy. I never thought about it in that way. Yeah. Well,
That's
thank
all
you.
we got. Thank you for watching our lecture.
Yes, thank you.